Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Shayla Toombs-Withers, who's a osteopathic physician, board certified in family medicine and obesity medicine, and the founder of the Essence of Health and Wellness Clinic in Chattanooga, Tennessee. Welcome, Dr. Withers. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thank you so much, Dr. Sabatino. I'm happy to be here with you.
It's such a pleasure to meet you. I noticed that, you yourself have really been trying to integrate, plant-based information along with your knowledge of medicine and so on. And you've been living plant-based for, close to 15 plus years. Mm-hmm. What are some of the influences or the aha moments for you that kind of led you on that path?
Yeah, thank you for asking. And I love sharing my own story because I feel like it's relatable. It was one of those things where I just started to notice as I got into college, every time that I ate, I would develop this abdominal pain. And it really seemed to just didn't matter what I ate. Every time I ate, I'd be either doubled over in pain or have just, really significant gastrointestinal distress. So I did the thing. I went and saw my doctor. They did the test. They did what I call the $1 million workup, the scans, all the tests. And long story short, everything was normal, thankfully. But I saw a gastroenterologist, so I saw the specialist, and then he mentioned starting an elimination diet to try. And so the first thing he mentioned to try was to try a lactose-free diet because, me being African American, he said, well, a lot of people of color tend to be more lactose intolerant. So let's just try it and see how you feel. So I did. I tried it initially even just 2 weeks, and it was amazing, in just that short a period of time, how much better I felt. I was able to eat and not have to stay close to a bathroom or, be doubled over in pain. And so just that there just really was that aha moment for me because it sparked that interest to say, well, this just one thing, did all of that, then what is food really, doing to my body, and what is this, food thing doing? So, I continued to learn, went through medical school, started picking up some of the plant-based books, ran into the China study. As any plant-based person, I'm sure, has either read or listened to the China study. And from there, I was really sold. I was like, it was the science, that ultimately showed me too, just from, books like the China study and some of the other older books that were out there and documentaries. And I said, yeah, I really need to even clean up my way of eating even more. So after I had my child, I really got on board to say, okay, I'm cutting out meat and dairy. I wanted to make sure that I was going to be in, good health for my child, as a lot of us do. And so I did. And I noticed the change in my health. I started running, and I was never an athlete, but just changing my diet. I started running, started doing marathons, triathlon, just fueled by
Shayla, were you, excuse me one second, were you already a physician at this point when you were doing this?
At this point I was.
Okay.
Yeah. Yep. And so then,
when you went into your osteopathic training, you had not really been into this yet.
No, not yet.
Okay.
Nope. Yeah. And so, because it was one of those things, once I learned about the dairy, it was like, well, it's kind of a choose your adventure kind of day. It was like, okay, I know if I, go have this, I'm from the South. If I have this mac and cheese, then I know this is probably going to happen, but it's like a choose your adventure thing. But after just the more I learned and the more I read and just really got on board and making those changes.
Yeah, so that's a big issue. It's
Mhm.
unfortunate because when you think about it, you can make a case that even politically and racially this is an issue because if you think about it, in the inner cities, milk as part of the school lunch program
Yeah.
when you're dealing with a lot of ethnic groups
Mhm.
that are absolutely ravaged by the presence of dairy in their diets, and you're feeding that to children, reinforcing these health issues that it's just not a conscionable thing to do. It really needs to be addressed at
Right.
that level
Yeah,
because
you're exactly right.
it's an insidious thing that goes on.
Yeah, yeah, you're exactly right. And, for like you said, I have school age children myself. And so what I know, there are no alternatives that they're given in those school lunch programs, that you're given the dairy milk and that's it. They don't have any non-dairy options unless you send it yourself. But then as we know, that's a whole other issue for parents who maybe can't afford to, package up lunches and send for their kids. So.
What drove you into osteopathic medicine early on? Uh,
Yeah, yeah. I
because for me, osteopathy had a long history of even physical medicine in terms of manipulation and so on.
right.
In your training, were you exposed to some of that old history of true osteopathic treatment?
Yep, for sure. And honestly, that's what attracted me to osteopathic medicine because the premise of osteopathic medicine is the body having the ability to heal itself and the body just being, a magnificent machine, if you will. So it can do so many things that we don't even give our bodies credit for. And that even without me realizing that early on into medicine, what I know now, that's ultimately ultimately a lot of what I teach, the body healing itself, using food as medicine. And so the osteopathic principles played a large part into that. And I was drawn to that. We certainly also incorporated manipulative therapy into our training. And it's been great because it also taught me early in my career that there alternatives to what we can do. Yeah, we can do the traditional medical thing where we're good at writing prescriptions, but we can also send someone to acupuncture or have a person try yoga for their mental health, or there are certainly other modalities that we can employ.
Yeah, I'm here with Dr. Shayla Toombs-Withers, the founder of the Wellness Center in Chattanooga, Tennessee. We're going to take just a short break from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here, encouraging you to check out the NHA membership. For just $35 a year in the US and $55 internationally, you'll have access to a wealth of resources, including our quarterly full-color print magazine, Health Science. Stay updated on the latest health tools, inspiring stories, and exclusive events like the NHA Conference and plant-exclusive cruises. Join us at healthscience.org/membership and make a difference in your life and the world. I'm Dr. Frank Sabatino, your host, and now back to the NHA Health Science Podcast, where more exciting insights await you. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Dr. Shayla Toombs-Withers, osteopathic physician, who spends a lot of time integrating food as medicine, plant-based food as medicine, into her practice. Shayla, talk about the evolution of your clinic and what the vision of that is for you.
Yeah.
Because I know that you wanted to integrate your medical experience with plant-based nutrition and even the idea of athletic training
Mhm.
into kind of a personal physician approach that you created. So let's talk about that special clinic that you've created.
Yeah, for sure. So I, over the years of my career, I worked in a number of capacities. Worked in urgent care. I worked as a professor in a residency program in community health. But the one constant that I found was that one, there was never enough time to spend with my patients, and two, many of my patients would have these same chronic things that we see: high blood pressure, trouble losing weight, diabetes, heart disease. And, all we had time to do is really put them on another prescription, because this is, what the algorithms and the insurance plans that we had to do, but not really teach them other things that they could do beyond that. And so knowing what all plant changing my own diet had done for my own health, and me being able to get more in endurance training, I wanted to start my own practice so that I could just really do things my way that I knew would be helpful for my patients. And so that's what I did. So within what I do at Essence of Health, I have a lifestyle medicine program. And so what we do is, when my patients come to see me, they get a wellness plan. And so what it entails is we talk about their diet and different ways that they can incorporate more plants on their plate, especially if we're trying to target or reverse a certain chronic disease. We talk specifically with recipes. They get recipes from me. They get handouts, nutrition facts and tips. So definitely more than just what you would get at the traditional office. We also talk about movement. And not just even just, things that they have to like go out and join a gym even, but ways that they can incorporate movement so that it's fun and that it becomes natural for them and sustainable for them. And so we look at what that might look like within, if they have a job that may take them away from, their personal time a lot, or if they have children. So we look at ways that we can incorporate movement sustainably. And then we look at the mindset piece, because what we know too about our mindset is if we're putting negative thoughts in, we're going to get negative outcomes. And so we look at how making those positive changes and positive mindset shifts also can be helpful. And that also looks like making sure sleep is optimized and making sure stress management is discussed and taken into account. So we look at all of those factors and create wellness plans so that we get people into the best of health.
In your clinic, do you have other professionals that address these kinds of issues? I mean, how
Nope.
much of your clinic is a collaborative effort between different kinds of professionals and backgrounds?
Yeah, so it's me. I am a solo physician practice, so I'm the only physician in the practice. I also have a background. I've been certified in plant-based nutrition, so I do the nutrition coaching myself. I do have some other providers that do fitness training with my patients, and so I have some who do it right there in their homes. And then also I've worked with some other local folks who we created a video course even so that people can do those things virtually too.
Is the practice solely face to face, or do you do stuff online too?
Both. Yeah. So we
You do it
do
online too. So
office and
talk about
virtual.
the online approach.
Right. Yeah. Yeah. So it's very similar. And it's actually, works really well. I'll give you the example. If there's someone who we're working on their diabetes, for example, I don't necessarily need to see you in the office so that we can monitor your blood sugars, and because we can use continuous glucose monitors now. And I'm able to monitor those things remotely. We're able to dial in and talk just like how you and I are chatting today online, and go over their diet. They're able to, I have them upload apps sometimes that they use, and they can send me their nutrition plan and what they've been consuming so that we can take a targeted look into that, or even discuss how they might can cook something different. As I'm sure you may know, a lot of times when folks are starting on a plant-based diet, they may not even know how to saute a vegetable without a bunch of oil, for example. So we even look at, those fine-tuned things, and we're able to do a lot of that virtually, and not necessarily have you come in the office for that.
We know how important in terms of overall health and wellness, the community sense is. How, when people have connection to other people doing like-minded stuff. Through your clinic, do you foster that kind of local community sense? And let's talk a little bit about how you do that and how that plays for your patients.
Yeah, yeah, certainly. So yeah, and you're exactly right. Community certainly plays a huge part in our health and us getting the appropriate support. So one of the things for member, because I call them members, my patients, they join a membership. So the members of my practice, they also get group coaching once a month, and so we're able to come together as a group. They're able to throw out any questions so that sometimes people don't know what they may not know or what they may, be missing. So you're able to hear that other person's question and then get that answered for you too. And then also ask your own questions and see, other challenges that folks may be having. So I do offer that for the membership. And then I'll actually have a separate, just virtual coaching program that's just for women who, no offense to you, Dr. Sabatino, but it's just for women who have insulin resistance conditions. And it's all virtual. So we come together twice a month. On that, I coach on I present a topic to them first, more like a teaching, and then with live Q&A, and then they also get some pre-recorded nutritional videos and some other goal-setting activities and recipes and things into that program.
That's fantastic. The demographic, I know that you have a board certification in obesity medicine too. How does that demographic in Chattanooga, where you really are centered, how does that play for this pandemic? I mean, are you dealing with a huge obese population? Are you dealing with a racially centered population? I mean, I don't know how Chattanooga is set up. And we know, for example, that when you look at Latino and African American populations, they can deal with obesity even to a greater extent than the typical population. They can deal with high blood pressure and certain of those outcomes more than a typical, population. So is that something that you address and deal with in that Chattanooga area? Because I'm not really well versed in the demographics of Chattanooga.
Yeah. So that's a great question. So Chattanooga is not the most diverse city. I will give you that. We are close. We sit right in the middle of Nashville and Atlanta. So you will definitely see much more diversity, of course, in those areas versus Chattanooga. But we do have a population of African American residents as well as Latino residents here in town. And in terms of obesity, as we know, the entire country, the world, even, are challenged by obesity right now. And what we do know, and one of the reasons why I actually did the obesity medicine fellowship is that there's so much more to obesity than even we knew just 10 years ago. And so being able to learn that and to be able to tap into that to actually get people healthier has been a great experience. And so one of the things that we look at with obesity is health, because for a large part, for so long we were so focused on the weight and the number that we got beyond the actual health outcomes. So when I see folks, we look at the health outcomes and then the weight tends to follow with that. So for example, if Mr. Jones already knows that he's got diabetes, well, let's fix your diabetes, Mr. Jones. And chances are we're going to be fixing his weight too. But for a lot of people, I say that because that also goes back into that kind of mindset shift too. Because if we're always telling Mr. Jones every time he comes into the office, oh, Mr. Jones, you gained 20 pounds, or, just looking at that, then those folks tend to, one, they avoid doctors because we've seen that too. And that's thought to be another contributing factor to obesity, because people just, are disheartened with coming to see their doctor. But then that also makes those folks not as apt to want to make changes versus if we look at other health outcomes and focus in on those things.
Yeah, the shortcoming has always been not distinguishing between weight and body fat. Because the problem is the numbers on the scale, while they create such emotional upheaval in people's lives, they're not really addressing what's important.
Right.
The real issue is body fat behind that weight, because body fat is what's producing inflammatory change and a lot of negative connotations that even contribute to things as far-reaching as cancer. So the whole field of weight loss has always been a kind of shallow approach focused on body image rather than the underlying conditions that are so essentially important in this story. So, and of course, when people have issues with weight, they feel ostracized, they feel, shamed in certain ways, and they need to realize that it's a risk factor that needs to be addressed the same way you would address high blood pressure or high cholesterol or any of these other issues. So
And
I'm
I'm
glad
glad
that.
you mentioned body fat, Dr. Sabatino, because one of the things too that I do in the office is body composition analysis. And the reason I do that is just like you said, because we can't just look at just that number on the scale and we can't
Right.
just say, oh, your BMI is A, B, or C, then, this is you, because what we know is there are so many other components. So we look at your muscle mass, we look at your body fat percentage, we even look at your visceral fat, which is that fat
Right.
that we can't see in those fat deposits around the organs. Because what I've even seen in my practice is some folks who probably, they'll fall into that normal BMI or they look to be a normal weight, nothing that would be ostracized. But when we look at body composition, they actually do have, other risk factors there. Their body fat percentage is high or their visceral fat number is
Right.
high. And then when we do testing, we even see even more with those biomarkers, with high cholesterol, or they're maybe showing signs of insulin resistance, but they aren't necessarily obese. So it's so much more to it than just that number.
With that in mind, are you dealing with a larger or more people coming to you looking for these quick fixes with these diabetic drugs like Ozempic and Wavery? And how do you handle that? Because that's gotten such a popular airplay, even with celebrities,
Yeah.
without looking at the fact that such a small percentage of weight is actually changed. Weight jumps back on when you come off of these drugs, and the risk factors with digestive GI problems, projectile vomiting, and so many other issues related to these fast fix drugs now, these designer drugs off
Yeah.
label. So how do you deal with that? And are you seeing more of that, of people
Yeah.
coming in your practice with that?
Yep. Yeah. And so I do have people come into my practice and I do incorporate weight loss medications as a part of their plan. But it's like you said, there is no quick fix. And I honestly, feel like because of the celebrity hype, these drugs have been misused a lot. I will
Absolutely.
totally say that. Yeah. Because what a lot of people don't know is that there were similar drugs, same class, that have been on the market for years, that we've been using. But now, you get a couple of famous people to say, hey, I lost a few vanity pounds, and now everybody thinks they need it, but they don't want to do the other side to that, which is what we're discussing with, those lifestyle changes too. And so even when I see people in the office, that's why another reason why I have people in a membership. So we're not just I'm definitely not like the med spa that you might hear some people go to and they say, yeah, I just go in and they give me my script and I go about my way. Nope, we're doing an entire comprehensive program. Like I said, I'm sending you out with some plant-based recipes and some fact sheets. We're meeting up about your nutrition. We're looking at the way that you're moving. We're looking at if you have sleep apnea and if we need to fix your sleep. And we're looking at those biomarkers. So we're definitely doing a comprehensive program, because you're exactly right. If you just suddenly go off of these medications, then you're just right back where you started if you haven't instituted some other things into place. And then the other part to that is the health side. If, yeah, you might have lost 25 pounds, but did you reverse your heart disease risk factors?
Right.
We have to definitely look at it more comprehensively.
Well, that's great that you're doing that. Do you find, because it's always an issue, as you know, when people are making lifestyle change, the issue of compliance is always an issue, because you go home, you get the influences at home, you get those friends that are telling you, why are you doing that? Come on out, let's go out and eat, let's go do what we want to do. So how do you really work with that mindset and that compliance factor, and how successful do you feel you've been with your approach?
Yeah. So one of the things I have folks that I work with do is goal setting. And so with that goal setting, one of the first questions that we look at is why. So why do you want to make this change? Why do you want to eat more plants? Why do you want to lose weight? Or why do you want to get off your blood pressure medicines? Because finding that why is ultimately what's going to help them stick to that plan. Because if it's just, oh, I just, don't like taking lisinopril, for instance, my blood pressure medicine, that may not fly for so long versus if it's, I've had patients when they explain their why. I've had one say, well, I want to be able to take my grandkids to the beach and be able to actually walk and run along the beach with my grandkids. So that's a much, something that makes it more sustainable for that person because every time they might, get with friends who are saying, oh, why are you eating, that bowl of broccoli? Well, that person can think back and say, hey, my why is I'm going to go to the beach with my grandkids versus, I'm just not going to take my lisinopril. So you really have to focus in on those goals and the why behind those goals. And I find that approach has been very helpful for a lot of people, and even refocusing on that why, and even once we reach certain goals, resetting goals. We all can always have a new goal. So that's really the approach I use.
Yeah, that's fantastic. Personal goal setting with very meaningful goals
Mhm.
is a great strategy. It's fantastic. Shayla, before we go on any further, where can people find you? What's the best location for them to learn more about you and what you're doing?
Yeah, so Essence of Health Wellness Clinic and Coaching. I am physically located in Chattanooga, Tennessee. I can be found online at drshayla.com/EOH. And I'm on social media under Essence of Health or under Dr. Shayla. So both
Is
of those.
there a limitation for people coming to you because of licensure or someone from another state, or how does that work for you then?
That's a great question. So, because I practice telehealth, I'm actually licensed in about 30 states. So I can see people in a variety of states. And if people have a question, if their state is included, I just recommend they contact me. But even within just my virtual coaching program that I mentioned, because that's not entailing any medication prescribing or anything of that, I'm strictly just teaching you how to make these lifestyle changes, then you can really be anywhere and join us in that program.
Yeah, so that's not an issue.
Yeah,
Only if you're really addressing medication and things of that
exactly.
nature.
Mhm.
So let's talk about how Dr. Withers takes care of herself.
Yeah,
So talk about you, what your routine kind of things. Let's talk about
yeah.
what you do routinely as an inspiration for people that are watching.
Awesome. So yeah, I do a couple of things. So I enjoy my kind of mental break release is running and walking, particularly on trails. Like I said, I've done some triathlons in the past, but more recently I've been more into trail running, hiking. I love the outdoors. I love camping. Really anything that can take me outdoors is how I relax my mind and how I stay fit and healthy. Of course, I eat plants every day. Some of my staples. I buy those big, large tubs of salad and large tubs of spinach every week, and easily go through them usually within a few days. And I just make a variety of meals based on those. Typically, adding some brown rice, some tofu, tempeh, beans, different things. I'm not I give my patients recipes, but I honestly, because I've done it for so long, I don't really follow recipes anymore. So I'm just kind of that person that just will throw some stuff together.
Yeah,
Um,
after a while, it becomes all kind of like Buddha bowls. We just
exactly.
put
Yep.
it all in a big tub and just kind of go at it.
Right.
I
Exactly.
know exactly how
Mhm.
that is. You
Yep.
want to
Yep.
simplify things. In your
Mhm.
own training, you do resistance training yourself. You do endurance work like that too.
I do. Yeah. Yeah. So I'm a big fan of Peloton. I have a Peloton at home, and so I still love cycling. Like I said, I love running, and then I also do the Peloton app. They actually have some really good. We've got a home gym, so my husband and I both we have a bunch of variety of sizes of weights and kettlebells, medicine balls that are weighted, and so we just incorporate those things. Typically using the Peloton app for that.
Yeah, my partner recently got one of those, and it's the first time I tried it. It was pretty amazing. I liked it a lot,
It is, yeah.
and
And what I love is yeah, the
especially the
instructors.
trail apps and all of that. They're really
Uh-huh.
quite amazing to
Yeah.
really motivate. The motivation part of that is
Right,
amazing.
that's what I was gonna mention. Yeah, the instructors are very, inspirational. Yeah.
So where does Dr. Withers want to go? What do you see coming down the road for you? What kind of things do you want to accomplish? What is it that you'd like to really fulfill?
Yeah, I love that question. So, ideally, I would, love to speak to more people about putting plants on their plate. I spoke at the International Plant-Based Nutrition Conference last year. It was my first conference that I had the chance to be a speaker at. And so I just really would love to do more of that, kind of spreading the word about this type of work, especially in the medical field, because for so long we haven't seen medical doctors really, promoting this lifestyle. So doing that. And then my long-term stretch goal, and I'm putting this out in the world because you asked me, is that I want to have like a farm to table kind of center where people can come, they can learn how to cook these meals, they can eat these meals, they can stay for a weekend. It's not there yet, but I'm putting it out into the atmosphere.
You think the climate in Chattanooga is good for that? What do you think?
I do. We do. We actually have a pretty large population of plant-based eaters here. Even though we're not a very large city, we have a lot of plant-based restaurants, like strictly plant-based, several in town, as well as online support groups. Chatta Vegan is one of our big groups in town. So.
And do you find yourself lecturing and teaching at a lot of those locally? How does it work for you?
Yeah, I have at a couple of the plant-based restaurants. I have participated and held workshops at those. I also hold workshops in my office. The most recent one I had was just a few months ago in the fall, where I did a cooking session. So I taught them how to cook a couple of quick and easy family plant-based meals right there in the office. I had people come in and they could learn how to cook this way as well as eat. I had one lady, she told me, she said, I had bought tofu and she bought it like a month ago because she wanted to try it, but she was afraid to even open it. So she never opened it, just sat it in.
That's very funny.
Right. So she came just so that she could, feel comfortable with trying.
So she had this festering month-old tofu.
Right, exactly. Yeah.
That's very, very funny. How is the climate where you are in your communication with other physicians? Because you take a certain kind of an approach, do you find that the community of doctors are a little bit more open now, even in Chattanooga and so on, where you're working?
I will say some. There are some who still kind of, see plant-based lifestyle medicine more as far-fetched. We still have the keto doctors is what I'll call them,
Right.
who are still thinking more in terms of that. But we even have some other lifestyle centers here in town. So we have a good group of us too.
Well, Shayla, as we wind this down, do you have any words that you'd like to share with the audience before we break?
Yeah. So really, it's just my favorite quote, let food be thy medicine. And what we put on our plates can heal our bodies and can help us to feel our best. And so even if it's just starting by just putting some more plants on your plate, whatever that may look like for you, I just tell people just to start there.
That's beautiful. I really want to thank my guest today, Dr. Shayla Toombs-Withers, for taking the time to share her heart, her work, her inspiration, her insight. And I urge people that, would love to learn more about her and discover more of what she's doing to go to the website, which you'll see in our show notes, which we will share with you in our show notes. And I urge you to follow her and, learn from her. She's got a lot to offer, and it may be something that can affect you and your family members in a very positive way. I also really want to thank the people that have joined us today, because without you, we can't do what we do. And I really want to thank you for being part of this very active and healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I want to thank you for joining us. And I look forward to being with you on the next episode of the Health Science Podcast. Thank you so much, Dr. Withers.
Thank you for having me.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.